Hello, my name is Lindsay LaGrange and I'm the training coordinator here at THN. I wanted to talk a little bit about Homeless Management Information System, or HMIS, and some of the many benefits of joining the Texas Balance of State Continuum of Care HMIS. First, let's talk a little bit about what HMIS is. So as I've already said, HMIS stands for Homeless Management Information System, and it is a computerized data collection tool specifically designed to capture client-level information over time. It collects information on the characteristics and service needs of individuals and families experiencing homelessness, as well as the services provided to those clients. I'd first like to talk about some of the benefits for providers that use HMIS. By utilizing HMIS, you can have data-driven decision making. So when you make decisions about how your program should operate, you want to know that you're basing those decisions off of supporting data. HMIS provides a way for agencies to assess program performance, allowing you to see what's working. Utilizing HMIS also allows for program reports for funders and stakeholders. Our HMIS not only has the reports HUD requires, but also has dozens of reports that focus on client demographics, services, referrals, and data quality. These reports can be utilized regardless of your funding source to get a sense of the population that you serve. Using HMIS, you can also coordinate and track services between agencies. So if a client has accessed multiple programs and services from your agency, you will be able to see that on the client's HMIS dashboard. If other providers in your community also utilize HMIS, you will be able to tell if the client has been served by other agencies. This helps the process of coordinating services. And finally, by utilizing HMIS, you can track client outcomes. So how long was the client in your system? Where did they end up? What services did they receive, and did they reach their goals? Did your agency meet its own housing goals? Our HMIS provides agencies with tools to gauge and report on client outcomes and larger agency-wide outcomes. Now let's talk about some of the benefits for our communities that utilize HMIS. First up, informing systems design and policy decisions. By utilizing data to identify service gaps in our communities, we can better inform local and national policymakers and fill those gaps. Identifying service gaps. HMIS makes it easy for administrators to find those service gaps in the data by recording unmet needs, identifying returns to homelessness, and viewing waiting lists for permanent housing programs in your community. Unduplicated client counts. HMIS client-level data is consistently audited for accuracy. HMIS administrators are able to thoroughly comb the system to ensure data accuracy, as well as verify an unduplicated count of clients accessing services in the community. And finally, understanding the extent of homelessness. So HMIS creates an environment where community-level data can be analyzed and interpreted. Without looking at the big picture data, we lose an important opportunity for system-wide policy decisions. And finally, let's talk about the benefits for clients. So first up, coordinated case management. Some clients access multiple programs within the same organization or at different agencies within that same community. HMIS provides a way for case managers within different programs or agencies to see what assessments, services, and referrals a client has received. And because of that, the client may not have to relive any traumatic situations by retelling their story over and over again. Next up, streamlined referrals. You can see when a referral was made, to where, and for what, as well as keep track of the status and result of that referral. For referrals to providers that use HMIS, the referral is digital and instantaneous, meaning the client doesn't have to personally keep track of their referrals. And finally, decrease of duplicate intakes and assessments. So when clients are entered into the system, their basic demographic information is saved to their personal record, and users can see when a client already exists in the system. This cuts down on potential duplication of intakes and assessments. So that wraps it up for the HMIS section of this video. If you'd like to learn more about HMIS, or if you have any questions, you can email the HMIS team at hmis@thn.org. Thanks for watching.